We have several pretty mature programs right now, one of them being our virtual nursing program. And so we have sort of a centralized team of nurses, both critical care nurses and nurses that are more focused on like med surg type patients. And the critical care nurses help us to sort of, I call it the nurses in the sky, the eyes in the sky. Anytime there's some sort of if there's a patient, they jump in, they help with documentation, they say it's time for epinephrine, they help to augment the care team by helping to provide some of that direction. But they also provide procedural support, they do quality rounding, they do proactive rounding for patients with elevated risk scores based off of machine learning models that we have in place so that we can be more anticipatory about what patients need instead of reactive. And so that's a huge area of support and resources that we have. And then our med surg nurses really focus on the function of getting patients in and out of the hospital more efficiently. And so I don't know if you've seen a nursing assessment recently for the things that need to be asked when a patient's admitted to the hospital, but it's voluminous. And a lot of it, if it's not relevant to that patient, is just really paperwork and busy work. And so by allowing, a virtual team to come in and take some of that work away and focus on it and really do reps of the same thing over and over, it allows the bedside to focus on the care they need to provide. And then same thing with discharges, the we see, things that happen all the time with care plans that don't get executed because patients didn't understand them because the person who needed to spend time and really explain it didn't have that time. And so, let's say a patient was supposed to be prescribed an anticoagulant, but for whatever reason, it didn't end up on the medication list. It's a place where really, a focused eye can pick up those things and make sure that we take care of it. So, that's one way we use it. We just recently, in October of last year, also put together, I think, a relatively unique concept called a virtual emergency department. We call it OVED for Oxford Virtual Emergency Department. And so we, as emergency physicians, receive messages. We do it all through our EHR, and we receive messages either from clinics or urgent cares or our nurse on call triage line, and we're able to just help them to take a look at whatever the patient's need may be. If the patient has to call 911, then they do that. But otherwise, people have a really hard time navigating what type of care they might need. I think patients are not great at self triage. They don't have the objectivity to do it often. So, do I need to go to urgent care for this problem? Is this something I can wait 3 days for? I think most people in healthcare get these text messages from their friends and family all the time. And so it's a way for us to be able to provide that type of, personalized kind of concierge expertise to everyone. And we're able to divert patients from expensive care and alleviate some of the overcrowding that happens in emergency departments by helping them go to alternate places where they can get that, even in a virtual sense. So those are a couple of examples of how I think about it.